New numbers out this week from the Alzheimer's Association, and there are big numbers. Now, almost 7.5 million people in the United States are living with this disease. It is a tough road ahead for not just them, but caregivers as well. And here to talk about a recent study that came out regarding the caregivers more or as much as the folks afflicted. Kristen Cusato with the Alzheimer's Association Northeast. Nice to have you back.
Thank you so much.
We talk about this all the time. We'll get into the stats in a second. That of all the horrible diseases, all the horrible ailments out there, this Alzheimer's kind of affects the caregivers. I don't want to say as much, but it really does hit the family more than just one person.
You can safely say that,
Right.
in that there is a point to where the person who has the disease probably doesn't know as much about what's going on around them, but the caregiver has to watch their person go away slowly, and that's painful. And it's financial taxing, right? It's emotionally taxing. It's physically taxing. It's all of it.
All right, so let's talk about some new caregiving numbers, and this one floors me. 1 in 18 people in the state is an Alzheimer's caregiver.
1 in 18.
That is.
We just found that out. We have 197,000 now people who are caregiving in this state, and that means, if we do the math, I'm not good at mathing, but 1 out of 18 people that you see is a caregiver for someone. So this is why they need to realize that there's education out there with the Alzheimer's Association. There are support groups, and to not do it alone, because these folks have, as you know, we've talked about this, increased chronic ailments, increased depression. It hits your whole self.
And that's why I said at the start that this kind of affects the whole family, because the caregivers are so busy taking care of the folks who have been afflicted, they're not taking care of themselves.
Absolutely, absolutely. And this is part of the Alzheimer's Association came out with this week the annual report of facts and figures, right? And that's these new statistics. But we're also talking about a special report that talks about brain health. And I think that's really important, because I think now, as you know, as we get to a certain age, it's all about aging well. What can we do now to make sure that we have good cognitive health?
So we have lots of stats to go over, but this one's the easy one to remember, because in terms of people who, in a recent study, view brain health equally or more as more important than physical health, it's 99%.
Just about everybody, right? Just about everybody knows how important it is to stay cognitively healthy. But only 9% know how to do it.
Right.
Know how to start the habits, know how to sign up for something, know how to stick with the habits. So have the conversation with your doctor. Don't just follow somebody on Instagram. Make sure the person on Instagram is legit, right?
Right. That's always a problem these days, because you see something on social media and you go, okay, I'm just going to follow them, and that could lead to more problems.
And go to our website. You know, we have something called 10 Healthy Habits to adopt those things, and just make sure that you're doing these things.
Which you've talked about before.
Yes.
Let's talk about this. The other facts that this brain health special report said. You surveyed 4,000 people.
Correct.
And you found out what?
4,000 people over the age of 40, and we found out that only 50% of them sleep enough, which is over 7 hours. I don't even want to ask you.
Yeah, I'm not part of that, thankfully.
Right? But only half the people sleep enough, and we know that when you sleep, the toxins wash away in your brain.
Yeah.
We also know that only a third of the people eat right, exercise, and do cognitively stimulating exercise.
Is this surprising to you?
Not at all.
Yeah.
Not at all. You can go. Why does everyone break their resolution?
Yeah.
It's the same thing. You can start gangbusters. So this is why it's important to get something that's going to follow you. Have some guidance. We have something called Brain Health Habit Builder, which you can go on our website and figure out how to do it that way.
Which is the other thing, because when you, as part of the Alzheimer's Association, are talking to families, what you hear stats like this, you do these surveys. What do you do differently? Is there anything that you tell families differently after these studies?
You tell them how important it is to do this, because why? Now we know, Matt, that these changes that are happening on our brain can be identified years before.
Right.
We're going to have a blood test soon that may show early changes, and then you can get on these medications, do things to change them early on. That's why it's important.
It is important for the folks who have been sadly afflicted. It is just as important for the caregivers. More information, the Alzheimer's Association, we will link you to Kristen and them via our website, fox61.com. You're always full of good information, good numbers.
So much for
we just want that number at 0 already. No more with Alzheimer's.
Let's change it.
Yeah. Thanks for coming in.
Thank you.
Thank you.